This is an interview with Mary Guinan on July 10th, 2008, at the Centers for Disease Control and Prevention in Atlanta, Georgia, about her involvement with the Smallpox Eradication Program. The interview is being conducted as part of a reunion marking the 40th anniversary of the program in Asia and East Africa. The interviewer is Melissa McSwegan. Now, with this interview, we are hoping to capture for future generations the memories of participants and their families involved in eradicating smallpox from Asia and East Africa. This is an incredibly important and historic achievement, and we want to hear about your experience. I have some questions to guide you, but please feel free to recount any special stories or anecdotes that you remember about events or people. So you signed the legal agreement, which says that you are donating the oral history to the U.S. federal government, and it will be in the public domain. You will have a chance to edit the transcribed interview and add or delete information as you see fit before it is made public. So at this point, I'm going to ask you to state your full name and that you know the interview is being recorded.
I'm Mary Guinan, and I know this interview is being recorded.
Okay, perfect. Well, could you maybe start out by talking about how your education and upbringing led you into working in public health?
Well, I'm not sure how my education and upbringing brought me into public health, but I'll tell you how I decided to be part of that I wanted to be part of the Smallpox Eradication Program. I was born in New York City, a child of immigrants. My parents were immigrants from Ireland. They were farmers. They had maybe 3 years of education, third grade education level. And they came to follow the American dream. And there was lots of political persecutions in Ireland, and it wasn't a good time. So they met on a ship coming here. Neither of them knew anyone here in America. And they established a presence in New York. My dad worked with the subway, the New York City subway system, and my mom had a job as a dressmaker, I think, first, and then she was working in a house as an assistant to the chef in a house in New York. And many Irish women came to America, worked as servants or assistants in large wealthy families, and that's what my mother did. And they eventually got married years later, 5 years later. Irish were very slow at this. I grew up in New York City, and they believed in education. They believed that that was the way to move ahead, and they loved this country because of its freedom and lack of persecution for your political views. And they were very, very loyal Americans and felt that this was really an important place to be and that we should be grateful. I was in the middle of 5 children. We should be grateful for that being born in this country and exactly what we had available to us. And so when I was a young teenager, my dad died very suddenly, and my mother had no means of support. And we all got jobs to work our way through school. And I worked my way through school and graduated from high school. I worked my way through college. I wanted to be a physician, but women weren't being admitted to medical school then. And also, one of the criteria for medical school was that you had to have money to pay for it. And there weren't scholarships available or other things available to students like me who really didn't have the means to do that. So I decided then that I would pursue other things. I majored in chemistry in college, and when I graduated, I couldn't get a job because they didn't hire women chemists. And so I was interested in, I got a job in a chewing gum factory.
Really?
Making chewing gum. It was the American Chicle Company. They made chiclets and all sorts of chewing gum. So Blackjack chewing gum was one of them, and I was a flavor chemist. I was hired as a flavor chemist. So I used to part of my job was making new flavors, developing new flavors of chewing gum. And it was not terribly rewarding kind of existence, but there wasn't really much available for women then. And I looked for fellowships and to try, and I applied to many schools, to graduate schools, and was rejected, mostly because I was a woman. And if I was accepted, I couldn't get a fellowship program because they didn't give them to women at that time. But at the time, the space program was in full bloom, and with Sputnik, President Kennedy has said we wanted to be in the moon. We were going to the moon, and there were became available fellowships for scientists. They wanted scientists to be in the space program, and I decided that I wanted to be an astronaut. So I found out that the University of Texas was where the space program was, near NASA in Texas, Clear Lake City, that the University of Texas Medical Branch in Texas had a program for scientists in aerospace medicine, and that the director of the medical program, Chuck Berry, Dr. Chuck Berry, had an appointment at the University of Texas there. So I applied to there to get my PhD in physiology and space medicine. And I wanted to be an astronaut. Of course, I didn't tell anybody then that I wanted to be an astronaut because it was one of the women didn't do those sorts of things. So I went to Texas, and people in New York said, "You won't last there for 6 months. You know, you're a New York person, born and brought up in New York." But I did. I lasted 4 years, and I went to NASA. I applied to all of my class in physiology and space medicine there at the university, took a test for the astronaut program, and I was the only woman who took it, and I was the only one who passed the test. Wow. The reason I passed the test was I had 20/20 vision, and all of the other people wore glasses. I mean, and you also had to fit into the capsule. You had to be, it was like the old days of being a flight attendant. You had to be, you know, a certain height and weight and not wear glasses. But I knew that it was unlikely that I was going to be an astronaut. There was a great deal of competition for it. And so I finished but I got to see all the astronauts. I took classes at NASA. And the astronauts would, you know, like John Glenn and Neil Armstrong, gave classes and talked about their experience in space. It was really exciting. I was really excited as a scientist. And I did a postdoctoral fellowship. I got a postdoctoral fellowship at the National Institutes of Health in Bethesda, Maryland. And it was during the Vietnam War, and I actually had gotten a place that was a man who had been drafted. So I filled in, and I knew that I wouldn't really be there very long because they saved the places for men who had been drafted and had gone to war. And it was very difficult for me to get a job at NIH because I didn't have an MD degree. And my mentor there at NIH said to me, it would be so easy to get you a job if you had an MD. You know, this is always the case. You know, if you just did this, you know, we could get you a job. So I applied to 2 medical schools. Since I was living in Maryland, I applied to the University of Maryland, to Johns Hopkins. And I got rejected from the University of Maryland and accepted at Johns Hopkins, which tells you something about the crazy system we have about being accepted into medical school. I was very grateful because I was sort of an alternative student. I didn't go from college to medical school. I had done this detour, and been in Texas, which, you know, most people think, what in God's name did you go to Texas for? In Texas, people said, what is this New York girl doing in Texas? And I think some of the presumption was I went to try and find a rich husband, you know, a Texas oilman or something. And that was the assumption of, there weren't very many women doing graduate work. And so I went to medical school, and I graduated from Johns Hopkins in 1972. And during that time period, I was continuing my career. I had done my PhD, my doctorate in physiology, in the area of blood coagulation, and I was wanting to continue my career and be a hematologist, oncologist, and go in academic medicine. That's what I thought I wanted to do. Never thought about public health. Didn't really know about public health. Went to medical school at Johns Hopkins, where one of the premier public health schools in the nation is, and, you know, took courses, but really had no interest in public health at the time. But I was interested in tropical medicine, and I did a tropical medicine fellowship in Mexico during my senior year at Hopkins, and was interested in tropical medicine. And then as I was graduating, this was the end of the 60s and the beginning of the 70s, and what happened during my last year of medical school really changed my life, in that what happened was Kent State happened. People were killed for demonstrating. This is a free country. Our government, you know, the United States government, which I was very proud of being an American, and was very, very upset about what happened, about the anti-war demonstrations that went on. And then these students in Kent State were killed, unarmed students, by the National Guard that had been called out. People killed, and I thought, what has happened to this country that I live in? How can this be, that we're living in this country where they're killing unarmed demonstrators? Our whole history of our country was revolution and fighting for freedom and doing what we thought was right. So what happened was I decided I wasn't sure what I was going to do. And so in my senior year, I read in this magazine, sort of like a magazine at Hopkins, about the Smallpox Eradication Program, some idea that there was this idea to eradicate smallpox from the world. And I thought, isn't that wonderful? What a great idea that we could eliminate a scourge. But it would be the first time in history that by the design of man or woman, there would be a human disease eliminated from the world. And smallpox, a very frightening disease. So, but, you know, I just thought, isn't that a wonderful idea? Didn't really think about much. And then after that, Kent State, and I started doing my internship in internal medicine with the idea that I would go on to be a hematologist and do a fellowship in hematology oncology. And as I was going, during my senior year of medical school, I was on the clinical service with someone who was going to be an EIS officer at the CDC. I had no idea what an EIS officer was, and he told me that it was the Epidemic Intelligence Service at CDC. And I said, what's that? He said, oh, it's a 2-year program, and you go there and you learn how to be an epidemiologist, which I really didn't have any interest in. And then I saw this other article in the Hopkins Journal magazine. You know, they have an internal magazine about the Smallpox Eradication Program worldwide, and that how our government was participating in it, our government. So I thought, wouldn't that be wonderful to be part of a government program that was really doing something wonderful? And it was part, and then I found out that the people who were going were being assigned from CDC, so you had to come to CDC. be and somehow get a job at CDC, and then you could be assigned to the Smallpox Eradication Program. So I talked to my friend at Hopkins about what this program, and he said, "Oh yes, it's EIS officers who are going over on the Smallpox Eradication Program." So I applied to the EIS program in 1973. I guess I was accepted, but and I came to interview, and I was the only woman physician in my class, that was accepted. And during that time, when you were hired at CDC, you were hired in the Commissioned Corps of the Public Health Service, which was an alternative to military service, and the draft was still ongoing. So people would say, "We're not accepting women here because if we do, another guy has to go to Vietnam. So we're not accepting women." During the interview, I was told this when I came to CDC for the interview. So I wasn't sure that I would be accepted, but I was. I don't know why, but I was. I was accepted into the program, and so I came as an EIS officer. I was assigned to hospital infections. That's in bacterial diseases then. And I would go. We'd have a Tuesday morning seminar in Auditorium B every week for all EIS officers, and we'd attend this meeting. And there'd be announcements at the beginning, and every time somebody from the smallpox program would get up and said, "We're looking for volunteers for the Smallpox Eradication Program." It's a 3 or 4 month assignment, and we're in India now is the part, and I applied to go, and they told me, "Oh, they weren't taking women." Now, Indira Gandhi was the Prime Minister of India, so it's like you say, "Well, how is it possible that that was the first round?" And then each week, they'd have somebody, and finally, Phil Brockman was head of the EIS program, and I said, "I keep volunteering and I keep getting turned down, but I don't know why. Can you tell me what the criteria are?" And so I think they thought I might make a fuss, because I actually had made a little bit of a fuss, although I didn't think it was a big deal, but everybody else thought it was a big deal. When I applied to for the EIS, I was accepted, but I had to we had to get 3 references from physicians who knew us to get it. And they sent me the reference sheets that had to be completed, and it was, "Will you please rate this candidate on his background, on his whatever he does, and is he a leader? Is he going to," and there wasn't a parenthesis for she. And so I sent back the forms. I said, "I'm sorry, I'm a woman. Do you have forms for women?" And apparently that caused some issues here at CDC before I arrived. So they figured, uh-oh, this is trouble coming. And they wrote back and said, "We do not discriminate, but we don't have any female forms." And so they crossed out the he and put her and she in the appropriate spots. And so when I came, I think that there was an idea that maybe feminism was just sort of coming into existence, really didn't exist until later. It was funny. So there was this worry, and I think so finally they said, you're going to India. So I went in December of '74 through early May of '75.
Okay, so that was about 6 months that you were in India.
Well, probably less,
Okay.
somewhere in there.
And what was your exact role while you were in India?
Well, what our roles were was to, we would be assigned to a district, some district area and you did surveillance for smallpox, look for smallpox cases. And then if you found one, you quarantine the case and then surrounded it with a ring of immunity in a 5 or 10 mile radius around, because smallpox spread locally. And this had been demonstrated in India. Actually, Bill Fege, who really was the person who worked this out and really is probably one of the people responsible for the eradication of smallpox, because he was in Africa, and he probably told this story and you've heard it, but they had a shortage of vaccine, and they tried to figure out how to use it appropriately, and they theorized that smallpox spread locally, and so that what you need to do is surround the infected person with a ring of immunity, and then it won't spread, because it only spread from person to person. There's no environmental reservoir for smallpox. Humans were the only source of smallpox, so you would find that. So that was funny. Anyway, that's what we had to do. And we would be assigned. We went to, when I arrived at my destination, we first went to Geneva. Our first assignment, we'd go to Geneva, and we met other people who were being assigned. And I went with Walt Orenstein from CDC, who you'll probably be interviewing too. He and I were both from New York City, and we were assigned together to Uttar Pradesh, and then we were assigned to go to Uttar Pradesh. So we were in Geneva, and then we were sent to Uttar Pradesh, and there was still smallpox in Uttar Pradesh. There were two provinces in India, Uttar Pradesh and Bihar, that still had smallpox. And so there was like a competition between Bihar and Uttar Pradesh of who would come first down to smallpox zero. And what we do is you would go out into the field, you would go and do surveillance. You were assigned a driver and a paramedical assistant. And then you were given all these checks, traveler's checks, like in rupees, because you had to hire people and you had to pay them. And then I would go to the bank and cash these checks, so I'd have lots of money to pay people to immunize. You had to get vaccinators. You had to get people to work for you. So I said, I didn't realize what the whole system was in India, but since my driver and paramedical assistant had been working, and my paramedical assistant was Shafi Mohammed. He was a Muslim, and my driver was a Hindu. And they spoke different languages, actually. Shafi spoke English perfectly, but his native language is Urdu, not Hindi. So that we had this three-way thing going on, trying to communicate with Urdu, Hindi, and English. I didn't speak any of either, but I learned to read the Hindi symbols, so I could read the road signs. I mean, there were very small, rarely was there a road sign, but if there were, the driver couldn't read. So I would phonetically sound the symbols on, so I could tell which way the direction was pointing. I would say Kanpur, that way. Okay, this is where we want to go. And the paramedical assistant acted as your interpreter, your cook, to find a place to stay. We were issued tents and sleeping bags and these mattresses. And thinking about India, I thought it would be very hot and didn't bring any warm clothes. But Uttar Pradesh is up north near Nepal, and it got very cold. It was 3 degrees centigrade when I arrived at the Delhi airport, and it was cold. So I had made a quilt, so I would wrap it around me because I didn't have any warm clothes. And we would go out, and we would offer a reward. We'd go like to a village, and the paramedical assistant would get up and say to the villagers, they had never seen a foreigner before, so I was a great source of interest to people. They'd look at me, this incredible. this was an area of Uttar Pradesh which was 99% illiterate. They had never seen a foreigner before, nor heard of America. And very often, if we went into a Muslim village, the women wanted me to come in their house because they didn't come out. They lived in Purta, they practiced. And so they always wanted me to come into their house, their little mud hut, and but they wouldn't allow my paramedical assistant because he was a man. So I would go in there and we would do sign language, and they couldn't understand, you know, where was my babies? what was I doing there? You know, and I found out, you know, most of the women were pregnant. They had babies every year, and while I was there, there were several babies that were named America.
Oh, wow.
Because they heard this word America. They had no idea. They didn't have a concept of another language or another place. And if they asked my paramedical assistant where I was from, he'd say, oh, she's from the capital, Lucknow. Because they had no concept of another country and languages, but they couldn't understand why I couldn't understand them. So it was interesting. So we would go to the village, and we had these picture postcards that showed cases of smallpox, and you'd say, 10 rupees to anyone who can show me a case of smallpox. And it was increasingly, 10 rupees is a lot of money then for the average person. And so if there was smallpox in the village, they would bring you to the person. Very often it was chicken pox, not smallpox, or something else. It wasn't smallpox. And you were supposed to be the expert. You know, not having ever seen a case of smallpox, it was like strange to think that you were going to be the expert and tell whether this was smallpox or chickenpox. Of course, we were taught at all of these training sessions how to do it. So, so we heard about a report of smallpox in a village that was supposed to be free of smallpox. And so I was sent there out of my district. My district was Kanpur, but this was outside of my district, a place called Rampur Matras. And so I went there, and I looked at the case, and it sure looked like smallpox to me. And at that time, we took a culture of the lesions and put them in a little vial and a mailing case. And then I mailed it off to Delhi, and they would either confirm, because they wanted to culture every case to see if it was really a case of, but it would take weeks and weeks before the results came back. And so I declared it smallpox, and we started our immunization. There were vaccinators who actually worked in all the villages. There's this infrastructure in India where they have this people who are vaccinators. And so they could be hired. So my paramedical assistant would just let out the word, and people would come and want to work for you because you paid very well. You know, you paid. And so what we would do is we would pay the people's family to be guards at the door. This is a mud hut, these villages. And then we would pay a family member to be the guard at the door. And the only people, they'd have to vaccinate them. They would have, anybody who went in or out of the house had to be vaccinated.
So this is the door of the house where the smallpox
yes, the smallpox case.
Patient was. Okay.
So here's a case. It was a young man. This is a young man, and nobody knew where he'd gotten smallpox from, and he was a Brahmin. The caste system was part of what was happening in India at the time. Although it was banned, it was outlawed. It was pretty much, that was the practice. Everybody recognized, when you went into a village, first thing people asked were what caste you were. And since I was an outsider, they weren't quite sure how to treat me. And so the Brahmin didn't want me to touch him. See, this young man They're Brahmins. And but I interviewed him to try to find out where he got smallpox, because he had to have gotten it from another person, and where he had traveled. And it turned out that he had traveled to a village somewhere, I'm not sure where he had received the services of a prostitute for his inauguration into his, rite of passage. But of course, this was not something that anybody could know about.
Right.
And it was not something that I would be able to track, to find out that case. In fact, they were very vague about where the village was and how it was. So we just decided then to employ a member of the family, it was a father, to be at the door, and then we paid a vaccinator to stay there and to vaccinate. And we paid the parents money to keep the person in the house, keep the young boy in the house, and to get food so he wouldn't come out until we declared him to be non-infectious. So we went about. And I found out when we go to the villages surrounding it, we didn't have maps. It was, it wasn't like you said, okay, let's draw a 5-mile radius around this. You try and find some maps to figure out what the radius was or how you can do this. So we got these rather rudimentary maps, and we started going to the villages to try to vaccinate. We found out when people would come, we had a jeep. They were Mahindra Jeeps, I think is the name of them. And they were provided by the Indian government, the Jeeps. And when the Jeeps came in, the only time the villagers ever saw a Jeep come in was when the family planning person came. And there was a big initiative in India at the time to reduce the population and to introduce birth control. And they used to pay the men to have a vasectomy, gave them a portable radio, was one of the gifts that the men would get. And they would try, and then there were these, the family planning people had quotas that they had to meet every month. They had to have so many vasectomies and so many tubal ligations. And they were not terribly receptive people, so they saw this Jeep coming in. They thought it was the family planning people, and they all ran away. So nobody would be there. So we said we couldn't find anybody to vaccinate. Everybody disappeared. In India, people would disappear and reappear. It was so incredible, the number of people. The Gestalt, when you go to India, all you see is people everywhere. There's never any privacy. You go out, you're on this road, and you're there, and there's wheat growing and things, farm area, and you go, and if something happened, if you broke down, my driver would just shout out, and all of a sudden people would appear, and they'd come out of the fields. There were people everywhere. They'd sleep in the fields. They were there, but the heat, they would be hiding in the shade. And so the whole idea of us being family planning people caused problems for us to be able to do the immunization. So what we decided to do was to do a survey of the town, to get all the names. And this was something that we understood was what the people used to do that the politicians used to do to give resources to a town or village. They would take a census, take a census of the village, and the village then, and then you would take the census of everybody who lived in each house in the village, and maybe there were 50 or 60 or 70 houses in a village or less, and there usually be sometimes 10 or 15 people living in that one-room mud hut. And so we would just come in and say, we're doing a census. And we'd go to the village elder and talk to him and tell him first that we were going to do the census. And then we would tell him, after we did the census, when we had all of the, then we would ask the elder if we could vaccinate the village and why. And if the elder agreed, then we could go and start the vaccination. So we would we'd go, but we knew how many people were there, and they'd all sort of list all these children. And you always knew that there was a child every year. So if you had a 1-year-old that looked like one, you would look for the baby somewhere underneath, hidden in blankets somewhere. There was always a baby. So we would find the baby. And it was just amazing. We would ask how old people were. They didn't know how old they were. It was just, that wasn't a concept to them, the children, how old they were. So we would just guess at their ages. And then we would vaccinate them and vaccinate each village until we completed the circuit. And then I'd come back every once in a while to make sure that the guard was at the door. We had these surprise inspections because people didn't really understand what we were doing. Thought, okay, if they're going to give me money for this, I'll do it. But then when I was out of sight, well, maybe not understanding why they needed to keep this person inside, they might not, so we would come back regularly to check, every 2 or 3 days. Sometimes there wouldn't be the guard at the door, and we'd say, okay, where's the guard? And we had the guard, and there was the vaccinator had a book in which he listed all the people he vaccinated so we'd know how it was vaccinated. So that was my first start, and it was smallpox. And then I kept finding more smallpox cases.
So that was your first case?
That was the first case. Okay. And then as we went from village to village, I'd find another one and declare it, then I would culture the lesion and send it off to the post office. And this is a big thing to do, to find a post office that would take these and send it off to Delhi. You'd never know whether they would arrive there or not, because sometimes they didn't have stamps at the post office, so you couldn't buy stamps, and it was a complicated system that you had to try and figure out, and how to ensure that your specimen got sent. And so I kept sending them off, and then we kept moving around from village to village. And the person who was in charge of Uttar Pradesh at the time of the Smallpox Eradication Program was Don Francis, and he would come to visit. And he came down to visit me about a month into it. I lived in a mud hut or outside, and my paramedical assistant would try and find some place for me to live, that would have a shelter. Sometimes we did, and sometimes didn't. It was very cold at night. And but there were all sorts of things. There were rats around. It really used to scare me. They'd come in and run around at night in your... and the Indians always respected life, so they'd never killed anything. The Hindus didn't kill anything, and so there'd be rats. One morning, there was a rat in my purse, and I told my driver there was a rat in my purse, and he just opened the purse and let the rat out. Okay. And so Don Francis came down to visit to see what we were doing, because they wanted to make sure, I was new. What are you really doing? And actually, I was a woman, and they weren't sure women could do those things at that time. And so Don came down. He said, listen, this place was declared free of smallpox, and you're you're sending off all these samples saying there's smallpox. Are you sure these are smallpox? I said, as sure as I can be. All I can say is, to the best of my ability, I call them smallpox. Sure they weren't chickenpox? I think they were smallpox, but, it's a possibility that they were. He said, well, be sure, because you're causing a big sensation here. The leader, the Indian health department, public health leader in the area, was very upset because he had declared his district free of smallpox, and I was saying that it wasn't. So that caused a little political problem. And anyway, it was miles. I mean, it took them several hours to come to where I was, and they went back. And then as I moved toward the other villages that were infected in this area, we had difficulty crossing the rivers. There were 3 rivers that, parts of a river that intersected the villages. And each time I would have to cross the river. And the Jeep, it was too deep for the Jeep to cross it. So I decided the first day we came to this, I said, we're going to wade across, because, it was like just up to, the water was about up to here, maybe my waist, and we're going to wade across with the supplies, and everybody would wade across. And so I always wore pants, because showing your legs is not something that, the Hindu women or Muslim women do. So I had made a series of Muslim outfits with like pants and a long shirt, a kurta I think it was called, and that's what Muslim women wore. The Hindu women wore saris, but the pants were much easier for me to work in, and I always kept my head covered. And I had very long hair then. It was a braid, and I decided before I went to India that I would dye my hair black so I wouldn't look so conspicuous. And
did that work?
No. Well, when the white roots started coming out, they thought I was going gray. It was, and it got streaked as it went. And I'm pretty tall, and I was taller than most people, so I stuck out in a crowd no matter what. But so I decided to roll up my pants. Now, I tell you that showing legs isn't a good thing in India, and there was nobody around. But after I rolled up my pants and started going across the river, a big crowd came, and there was this huge crowd, and I had rolled up my pants, and I'd walked over across the other side to get the supplies over, the vaccine and needles and things. And then we went and did a thing, and then on return, I realized I'd caused a sensation, so I just didn't roll my pants up. I just waded across. And word traveled fast. Who knows how, but it went to Delhi, and, people saying, oh, I heard you went to... Once a month we would have this meeting, and Bill Fagey was the head of the Indian smallpox eradication at the time when I arrived, and he would come up from Delhi. He would go to each of the districts, once a month, and he would come to Uttar Pradesh one day a week, and then we would all come in from the field. There were a number of us, and it was the first person that we would talk with. And we'd take showers. I mean, I might not have shower in weeks and weeks. And so you would stay at the hotel and meet friends, and they would tell you what was happening, and they'd show you how many cases of smallpox there were and how they were decreasing and how close we were to zero, coming to zero in India, and that UP was winning from Bihar. We were ahead of Bihar. So that was a monthly meeting, and when I was coming into town, we would stop at the railroad station, and I would know whether Bill Fagey was there or not, because, you know, Bill's very tall, he's 6'6", and they would always know when he came through the railroad station, he was here, so they'd tell me, he's here. So I would know he was at the hotel. People would know you were with the smallpox program, and they'd let you know. I mean, word would travel fast, and anything I did was reported. People knew what I was doing, you know. That was interesting. I didn't do that again.
How would you, let me interrupt you for a second, how would you say that this experience that you had, the 6 months that you had in India, how would you say that affected your career after that?
Well, I became a believer. I believed that this was the way to go. I decided that I was going to have a career in public health because it was so successful. I mean, couldn't believe it, you know, what you were doing and all the things you're doing and all the problems you were having. And you would come and it's working. It's actually working. So you were reinvigorated to go out in the field and keep doing what you're doing, because you can't really see the results, and you often see the errors that are made, and sometimes things slip through the cracks. Somebody didn't, you know, guard the patient, and did they possibly infect someone, and you had a whole trail of smallpox moving about. You know, you're always worried about that. But it worked, and so I decided to work in public health. That changed my life.
Did you keep traveling after that? Did you go to other countries as well, or?
Yes, I've been probably all over the world. I've been to Asia, Thailand, and China, and Japan, and Central and South America. I guess the only place I really haven't been is to Eastern Europe. Then the Soviet Union was during that time it was the Cold War. So there was lots of difficulty getting in and out of countries. And so, but I came back, and then I left CDC after my EIS program, and then was recruited back to CDC. And then I worked at CDC for 20 years, and then retired. I was part of the First AIDS Task Force, so I was trained virologist, and that's how I, you know, did how my career evolved.
Yeah, it sounds like you faced a lot of challenges before you went for the smallpox eradication campaign. Particularly, you talked a lot about being a woman and how that presented some obstacles as far as, you know, getting into school and so on. Did you find that in this particular campaign that being a woman affected the work that you were doing? You talked a little bit about, you know, when Don Francis, I think you said, came to visit you, how they kind of doubted maybe your effectiveness.
Well, they were worried, you know, as I would have been in Don's place.
Mm-hmm.
And it turned out they were all smallpox, but it wasn't. Well, I think it did affect people. I think it helped me a lot. People were much more trusting of a woman than a man in that situation when I go into a village. Oh,
as far as the Indians?
Yeah, the
okay.
Indians are concerned. They would, because I was such a curiosity to them. You know, and also people helped me a lot. I told you about these rivers. We had problems traversing the rivers, and the only way to get across was a boat, a camel, or an elephant. So there were always camel drivers, and we would just wait until a camel came along, and then I would rent the camel, and then we'd get across, you know, and then how I got back over the other side, you know, we'd hope another camel would come, or somebody would show up with a rowboat and would row us across. We'd pay them to take us across. And so this one day, while we were working in the village, this local Raj Saab, they call him, came, and he said, "What are you doing?" And I told him that what we were doing. He said, "That's wonderful." He said, "Well, since you're having this difficulty, I have an elephant, and I'm going to give you an elephant so you can have this elephant to go across the river." So I got this elephant. I mean, elephants swim, and they're wonderful. Camels are nasty. They want to bite you. You know, it's really difficult getting on a camel. They turn around and bite you, you know. An elephant, very sweet. And there was a mahout, an elephant driver, and he said to me, they said, when the elephant swims over this river, you know, he will take you up in his trunk. I said, oh, so you won't get that? I said, no, no. No, I'm not doing that. No, I'm not. I'll get wet. You know, it's okay if I get wet. So when we would go across, he would take the mahout, the elephant would take, it was a female elephant, she would take the mahout in her trunk and carry him over, you know, and swim to the other side. And then I'd go, and then we'd come back, and then somebody'd call an elephant, the elephant would come and then take me back on the other side. So, because Don Francis heard about this, naturally, and he came saying he wants an elephant ride. He came down, he says, I want my elephant ride. So he got an elephant ride, came down. So I'm not sure, I think this man, because I was a woman, he thought I needed, you know, help in getting across, and so he gave me an elephant. I gave it back to him. I didn't take it home.
Mm-hmm. That'd be kind of hard to fit in your carry-on luggage, I'm sure. What would you say is the most memorable moment that you have from your time in India with the smallpox program? The memory that sticks out the most?
Well, the memory is the first is the cultural shock that, you know, going to a country where you don't know the mores and learning them. It's sort of it was one of those culture shocks that it would take years to adapt, but you take these small steps. But I think that the most exciting thing was that it worked, and that these monthly meetings that we would go to, we would learn that it was working. It was just, and the whole idea that this is actually going to work, I mean, it's actually going to work, was intoxicating. So that was the most wonderful thing about, and the thing I remember. It was effective.
Mm-hmm. Well, is there anything else that you would like to add that, you know, to tell future public health professionals like myself about the time and the program and so on that you'd like to share?
I don't think so. I think I don't know what I'd say, except an opportunity like this where your government was doing something and you have an opportunity for public service. It's just, I don't know that I got any better satisfaction of anything I've done in my lifetime than feeling like I participated with so many other people from other nations to do something that improved people's lives. And you had an opportunity. I mean, it was a privilege to have that opportunity. So I feel that, you know, our government, who was doing what I thought such terrible things, but somewhere there was someone doing this wonderful thing. It was in, you know, these rickety old buildings at CDC that no one had ever heard of then. CDC wasn't in the spotlight. And, you know, all these Quonset huts out in Chambly, that's what people were living in. I mean, this is CDC, you know, it's these old government buildings. But these people planned, imagine they planned they were part of the planning of this momentous event. And I feel very privileged to have been a part of it. So it was that sense of, I guess, if you have that opportunity to do something that's outside of anything you could possibly do as an individual, do as a team, then that will surely be one of the most one of the greatest satisfactions in your life.
Well, thank you very much for your time, and thank you for sharing your stories.
Okay.